No more obesity. Obesity often occurs together with diseases such as dyslipidemia, fatty liver, hypertension, coronary heart disease, abnormal glucose tolerance, or diabetes. It can also be accompanied by or complicated by obstructive apnea during sleep, gallbladder disease, hyperuricemia, gout, and osteoarthrosis, venous thrombosis, impaired reproductive function, and certain cancers. Obesity may be a cause and risk factor for these health problems, and may also share a common basis with these diseases. Are you fat if others are not fat? The reason is here. In fact, 70% of human obesity is attributed to genetic factors. However, obesity will occur quietly only under the joint promotion of mental, dietary, environmental and other factors. Why are you fat when others are not fat? Take a look at the following 7 inches obesity factors, and see how many of them you have. 1. Genetic factors. If both parents are of normal weight, the probability of their children becoming obese is only 8% to 10%. If one parent is obese, the probability of their children being obese is 50%, and if both parents are obese, the probability of their children becoming obese is high. 80%. 2. Mental factors. There are 2 centers in the hypothalamus of the human body that manage hunger and satiety respectively. Research has found that factors such as excessive mental stimulation or nerve excitement, disease, etc., can disrupt the function of these 2 centers and lead to obesity. 3. Endocrine factors. Many factors will promote insufficient or excessive secretion of insulin, leading to increased fat synthesis and obesity. 4. Dietary factors. First of all, overeating obesity is the main type of obesity. After the energy intake exceeds the demand, it is converted into fat and stored, leading to obesity. The second is the preference for eating sweets. Researchers found that as the amount of sugar consumed increases, the proportion of overweight people and the proportion of diabetics will gradually increase. The third is the frequency of meals. Research has found that people who eat twice a day are more likely to develop obesity, abnormal glucose metabolism, abnormal lipid metabolism, and cardiovascular disease than those who eat 3 times. Appropriately limit staple foods and add fruits to snacks, which will be beneficial to energy balance and the onset of insulin and metabolism. 5. Insufficient exercise. Due to the advancement of urbanization and the use of cars for transportation, more and more people are less active. For example, staying at home, sitting in a chair, and not participating in effective outdoor exercise will undoubtedly reduce energy consumption, promote the formation of insulin resistance and receptor resistance, and lead to energy metabolism disorders. 6. Lack of sleep and biological clock disorder. Research has found that children who sleep less than 7 hours have a significantly increased obesity rate. In addition, circadian rhythm also affects the body's energy metabolism and glucose metabolism. 7. Bad living habits. Although smoking has little effect on body weight, smoking can lead to severe insulin resistance and promote the occurrence of diabetes, hypertension, and cardiovascular and cerebrovascular diseases. Drinking alcohol, especially eating a lot of high-fat foods while drinking alcohol, can also lead to obesity. Don't ask for speed. It's better to lose 1 pound of meat every week. According to experts from the Center for Chronic Disease Prevention and Control, obesity begins with fat accumulation, and the cause of fat accumulation is that energy intake exceeds energy consumption. This also gives us 2 ways to fight obesity: reducing caloric intake and increasing caloric expenditure. Simply put, it's eat less and move more. The meat-free recommendations from the World Health Organization are: limit energy intake from fat and sugar, increase the consumption of fruits, vegetables, beans, whole grains and nuts, engage in regular physical activity, 60 minutes a day for children and 60 minutes a day for adults, 150 minutes per week. In addition, when losing weight, don't rush for success. The speed of weight loss should not be too fast, and the weight loss goal should not be set too high. In the case of a low-energy diet and moderately increased exercise, losing 0.5 kilograms per week is the ideal rate for healthy weight loss. Losing 5% to 10% of the original weight within a year will be beneficial to health. Moreover, to avoid losing weight in pursuit of skinny beauty, the body mass index should be maintained at a normal level, 18.5, approximately 23.9 kg per meter 2.